According to the Centers for Disease Control and Prevention, antibiotic resistance is a quickly growing problem. Antibiotic overuse is the single most important factor leading to antibiotic resistance. Dr. James McKinnell at LA Biomed examines the increasing number of antibiotic-resistant infections.
In the last 10 to 20 years, seen a major rise in antibiotic resistance, particularly amongst infections that occur in hospitals. A hospitalized patient will frequently develop an infection with a bacteria that's very difficult for us to treat. And when I say difficult, I mean the Centers for Disease Control, the Infectious Disease Societies of America, they've sort of called it an emergency. This is a serious public health threat. Hospital and healthcare associated infections are the number 6 leading cause of death in the U.S. There are very common infections that we see that are easy to treat, but the infections that occur in hospitalized patients can be devastating. The development of antibiotic resistance has occurred over the last 50 to 75 years. Bacteria have been killing each other for millions of years. Our recent entree into this battlefield has been the development of antibiotics. And antibiotics kill bacteria, oftentimes using very similar mechanisms. We only have a few classes. So over time, antibiotic resistance develops. In other words, the bacteria learn how to avoid killing by antibiotics. And we see major outbreaks of those particular type of bacteria in our hospitals. We all carry bacteria in our bodies all the time. It's part of our healthy balance. It helps us to digest food, helps us to process toxins. So every single time you get an antibiotic, you're actually going to kill good bacteria and the bad bacteria. And you're also going to develop some bacterial species that are resistant to that antibiotic. They're going to live in your intestine for years. And that ultimately is what's going to cause the infection that's dangerous for you in the hospital. The analogy here is pretty simple. If you're a healthy person, you eat a normal diet, you carry healthy bacteria. It's like a forest. If I go in and give you antibiotics, it's like clear cutting the forest. I take everything out. I take all the trees out and a few shrubs are left. And that creates an environment where you can have weeds grow or invasive species kind of grow in. And that's dangerous. That's what antibiotics do. They completely change the landscape and you get resultant problems. Now, when we're talking about people, that resultant problem can be a very dangerous drug-resistant infection. So we have to understand when best to use those antibiotics and what antibiotics to use such that we keep your bacterial populations healthy and doing their job, which is protect you. In nursing homes, you have a lot of sick patients that are living in very close proximity. So if the first patient gets an infection with the drug-resistant bacteria, they can transmit it to the environment and to other patients. Understanding how to prevent these infections in nursing homes is crucial because that's ultimately the most vulnerable population. One of the biggest risks for developing antibiotic resistance is repeated courses of antibiotic therapy. So an individual patient that has multiple episodes of pneumonia treated with ciprofloxacin or another similar antibiotic, at each episode, the likelihood that ciprofloxacin is going to work again becomes lower and lower. And we're oftentimes forced to switch antibiotics. Eventually, after enough courses of antibiotics, we run out. It's a scary concept. So our research is focused in on understanding when we should be more aggressive with prevention. So there's a balance here between limiting use of antibiotics, which is valuable, but also using antibiotics intelligently. And it's the rational use of antibiotics that's crucial to make sure that we're getting the benefit we need out of antibiotics and try and minimize the negative impacts. And we need to develop a better understanding of how to keep our patients safe. And the research we're doing now is to look at different approaches for hospital cleaning, different approaches for cleaning of patients. We call it decolonization, but frankly, it's just using better soaps for patients and understanding when to bathe patients and with what soaps can prevent future infections. The solution is clearly prevention. You have to figure out how to prevent these infections, how to avoid them in the first place. We need to develop infrastructure to do that research that we're doing here at LA Biomed. The most important thing is to prevent these infections and work on research to make sure we never see these problems.